Okay, great. We're live right now.
Yep.
All right. Well, I'd like to start by welcoming everyone to the Vermont Center on Behavior and Health lecture series. Steve Higgins, the director of our center, usually does these introductions, but he is having some technology issues today, so I will take over. My name is Eli. I'm an research assistant professor here. And before I introduce our speaker today, just a few housekeeping things. We'll be doing Q&A, question and answer at the end. And so if you have questions, you can put them in the Q&A box and not the chat box. So I am thrilled to have the opportunity to introduce Dr. Peter Hayek, who will be giving today's talk on e-cigarette use and smoking cessation. Dr. Hayek is a professor of clinical psychology and director of health and lifestyle research unit at the Wolfson Institute of Preventive Medicine at the Queen Mary University of London. Dr. Hayek completed his PhD in psychology at Charles University in Prague, after which he worked as a clinical psychologist and then assistant professor at Pulaski University in the Czech Republic. Dr. Hayek then went on to work in the addiction research unit at the University of London before becoming the head of the psychology section at Queen Mary University of London. Dr. Hayek has a history of high-impact, innovative, and rigorous research in tobacco treatment. His research is primarily concerned with the development and evaluation of treatments and harm reduction strategies for dependent smokers and helping policymakers enhance treatment access. There are several strands of Dr. Hayek's research that have influenced international and clinical practices in policy, including the World Health Organization's framework, Convention on Tobacco Control, as well as the establishment of a national stop smoking service in the UK and other countries. So summarizing the long list of Dr. Hayek's contributions is really no easy task. So I'll just describe a few highlights. First, he has authored a series of early pioneering studies that describe the tobacco withdrawal syndrome and evaluated effects that potential treatments have on cigarette withdrawal discomfort. In addition, Dr. Hayek has developed and evaluated a range of behavioral smoking cessation interventions, including withdrawal-oriented treatment approach that informed the UK National Stop Smoking Service and its staff's training. He has a history of conducting a number of these first-of-a-kind randomized controlled trials of promising new pharmacological treatments, some of which are now used worldwide. And finally, he has been ahead of the curve in examining potential risks and benefits of e-cigarettes in a series of studies that informed some of the key UK policy initiatives and currently influences the ongoing international debate on harm reduction. With over 350 publications and more than 14,000 citations, Dr. Hayek has had a profound influence on the field of tobacco treatment and our understanding of nicotine dependence. Personally, Dr. Hayek's work has shaped the way that I think about tobacco treatment and harm reduction substantially. So I'm very excited to hear him speak today on the role of e-cigarettes. So with that, I will hand it over to Dr. Hayek to present his talk titled E-Cigarettes and Smoking Cessation. Can e-cigarettes speed up the demise of smoking? Dr. Hayek.
Thank you, Eli. And thank you, the organizers, for inviting me. After an introduction like this, I can only disappoint you. So I'll just go straight ahead. Let me start with, I didn't put in conflict of interest. I should have done. My research in these matters is funded by various public bodies and grants. I have no links with any e-cigarette or tobacco manufacturers. And I want to touch today on the following questions which inform the take on whether e-cigarettes are a good thing or a bad thing. How do the risks of vaping, which is a word for e-cigarette use, compare to risks of smoking? Because if there is no reduction in the risk, then of course it's not such a good thing. Do e-cigarettes encourage young people to take up smoking? Do they actually help smokers quit? And will the alternative nicotine delivery devices replace smoking? Let me just check that, because I've got two screens here and one is frozen on the front slide and the other one moves. Can you see the second slide with contents?
Yes.
Yes, good. All right. You all know what e-cigarettes look like. The first incarnation of the product looked like ordinary cigarette, including the silly red tip. Later on, and these early ones had very, very minimal nicotine delivery. Then it got better with larger batteries and these containers or tanks for putting the e-liquid in. Can you actually see my cursor when I'm circling around something?
Yes.
Great. And now people can put in the flavors and strengths of nicotine they want. And then there is a development of going back to small butter in small format, because people figured out how to put nicotine salts in these e-liquids, which allow higher nicotine doses at lower power and can mimic effects of cigarettes. And this is probably where the future lies and where these products are going to go. And this allows very close nicotine delivery to cigarettes. So first of all, let's have a quick look at the risks of vaping compared to risks of smoking. And let me maybe alert you to the fact that I'll be presenting a perspective which is now largely accepted in the UK and which may sound rather alien in the US for very interesting historical reasons, which we can discuss at the end if you want. Our countries diverged on the take on nicotine. Nicotine is considered fairly harmless and not that much different from drinking coffee on its own in the UK, while in the United States, it seems to be considered to be a dangerous drug. And I'll be presenting the UK perspective. Now, we have two large reviews of safety of e-cigarettes done in this country by the Royal College of Physicians and by Public Health England. And they estimate that the risks of vaping are unlikely to exceed some 5% of risk of smoking. What is this based on? Now, e-cigarette aerosol, this smoke-like substance coming out of these devices, it does contain some toxicants, but at levels that are much lower than in smoke. And most of the major toxicants, which are responsible for smoke-related death and disease, are absent. Now, there are some chemicals in e-cigarettes which are not in conventional cigarettes, primarily propylene glycol and vegetable glycerol, but these are considered safe for inhalation. There are some other potential risks, and some may yet emerge. For instance, flavorings. These are flavorants which are safe to eat, but inhaling them may have some adverse effects on the lungs. There could be impurities, some metals from which the device is made may leach into the aerosol. Overheated e-liquids may generate carbonyl compounds. But taking into account this future uncertainty, the current estimate, of course, that's going to be revised as new evidence appears, the current estimate is that it's unlikely to be more than 5% risk of smoking. Here's an illustration of that showing the key harmful chemicals in cigarettes and e-cigarettes. So carbon monoxide is all gone, particulate matter is 10 times lower, but what is more important is that this is mostly liquid. This is the type of particles you inhale when you're in a shower. It's not the type of particles which you have in tobacco smoke or from car exhausts. Free radicals, less than 1%, nitric oxide, all gone. Tobacco-specific nitrosamines, some are there, but much, much lower than in smoking. And volatile organic compounds, there are only 2 which seems to be generated, and I have a slide to discuss with you later. One of them 5 times lower than smoking and 120 times lower. Now, yet you probably heard many times about the risks of vaping. And I want to use this opportunity of giving a seminar on this to also go into methodology. So see it as information about e-cigarettes, but also information about how to read scientific literature and how to differentiate real findings from sound bites driven by agendas. And academics, none of us is totally free of agendas and having a story to tell. But in this field, this sort of dominates the discourse that findings are often interpreted not objectively. So we have four sources of data on dangers or risks of vaping, and two of them generate alarms and often make it into media, but they are of little relevance. One is animal studies, and usually animals are grossly overdosed with nicotine. It's not so much about anything else, but a mouse which weighs 100 grams is getting nicotine doses which grown-up smokers who weigh 80 kilos get, and the animals get damaged, and that's presented as a sign of risk of vaping. Then there are in vitro studies where cells and tissues will be exposed to e-cigarette aerosol, and very often actually e-cigarette e-liquid. So you will have liquid poured on cells, which of course damages them, but this has nothing to do with human exposure. Then there's the source of data which is relevant, but frequently misreported. And that is, you look at chemical contents of the aerosol. And there you do find toxicants, and you have to then compare the level of these toxicants with the levels in tobacco smoke and with safety norms, whether that's a level which is dangerous, because it's the dose that makes poison. The fact that the chemical is present by itself does not signal risk. And so whenever you see any report about this or the other chemical has been found in aerosol, always see if they compared it with smoking and with safety norms. And then there is one source of information which provides clear and relevant information, and that is actually toxin intake by vapers. So how much dangerous chemicals they actually take in compared to smoking and compared to not smoking and not vaping. And there's only a few of such studies so far, surprisingly, given how important this issue is. And if any scientists are listening, this is an area where we need more data. This is the first of these studies, actually only published in 2017, when long-term vapers were compared with long-term users of nicotine replacement treatments, which is considered to be harmless, and with smokers. They didn't have a group of non-smokers, which is a pity, but still the results were very informative. The nicotine intake was similar, and if we have time at the end, we can discuss the phenomenon of titration. People often express worries that e-cigarettes may overdose smokers using them, but of course they won't. Smokers titrate the amount of nicotine they're getting, and whether you give it through NRT or vaping or cigarettes, they would go for the level which they like. Tobacco-specific nitrosamines and volatile organic compounds were the same as NRT users and vapers. And if there was a non-smoking and non-vaping group, it would probably be the same as in them as well. And of course, much lower than in smokers. And here's another study where dual users, people who both smoke and vape, went to this research unit in Neil Benowitz's lab, and for 2 days they vaped, 2 days they smoked, and 2 days they were abstinent. And you can see that all these compounds were, if you compare the exposure from the days when they were abstinent and days when they vaped, they're all gone. But there's this acrylamide 5-fold reduction compared to smoking, which is a bit worrying. But the thing is, if we have more time, I can come back to it, but it's most likely carryover because the abstinent condition was always the last, and they were smoking prior to that. So it could be, and it has got 14 hours half-life. And benzene, 22-fold lower, everything else gone there. In our own study, we looked at people who smoke, and they were given e-cigarettes, didn't stop smoking, just vape and smoked. And naturally, as you would expect, if you get now good nicotine from another source, you will smoke less. That's coming back to this idea of titration. People only need that much nicotine, and if you give it to them through some other route, they will smoke less. And there's a reduction in carbon monoxide and proportional or even slightly higher reduction in acrolein, which is one of the carbonyl compounds, which is often invoked as possibly providing some toxicity from vaping. But in fact, it's much lesser delivery than from smoking, and in this case, seem to be just going down as well. Now, people often say we didn't know about health risks of smoking until people smoked for a very long time. So could it be that although we are not detecting any signs of danger over short term, that some dangers will emerge later? Well, if cigarettes appeared today, we would know very quickly that they are dangerous. It's just, the science advanced very much, and we now know what these chemicals can do. And the fact that most toxins are gone and the remaining few are largely reduced, that means that the risk must be massively reduced over long term as well. And we actually have an evidence of this from the story of snus. Snus is an oral tobacco, and it's been used in Sweden for considerable time. So now there we have data which are based on 40, 50 years use. And we also see how these alternatives to smoking replace smoking, that they don't, people sometimes say that if you provide this, you're increasing smoking. You don't. Sweden shows population levels reduction in smoking because people switch from smoking to using snus, but they also show population level reduction of cancer, myocardial infarction, tobacco attributable mortality. So here you see European Union smoking rates, and Sweden by far the lowest. Actually, it's even lower now. I think this is 2017. Now they only have about 4 or 5% daily smoking prevalence. And here you see death rate per 100,000 attributable to smoking. And again, Sweden is far below the other country. This is in men, by the way. The big switch to snus use is primarily in men in Sweden. Now, I want to use this opportunity when we're talking about false news and methodology to go over just a few of these health scares which you may have. And they are of concern because they put smokers off switching to something which could dramatically reduce their risks of dying as a result of the toxins in tobacco smoke. So one of them concerned, this one crops up about twice a year from various studies. Nicotine has a well-known transient effect on aortic stiffness and blood pressure. Nicotine is a mild stimulant, and if you and it has no relevance for health. If you drive a car or watch a thriller or watch a football match or exercise, you get these transient increases in these things. Now, drinking coffee produces the same response, but larger and of longer duration. And yet, when this is observed with anything else, it's considered to be fine. When it's observed with smoking, it makes headlines. And studies reporting these effects are then interpreted, showing that vaping is dangerous. I think I have a slide there from a British tabloid. On the front page, vaping as bad as fags. So, vaping is as bad as smoking because it has got this totally innocent transient effect. And this is the type of misinformation we are worried about. Here's another one, popcorn lung, which you probably heard about. It's still used, although it has been long debunked. There's been a number of cases of bronchiolitis obliterans in factories where workers make popcorn, and they are exposed to high levels of a chemical called diacetyl, which causes this lung disruption. And this chemical is also present in some flavorants for e-cigarettes, which gives them sort of a buttery sweet taste. But cigarette smoke contains much, much higher levels of this chemical than this flavorings does. And there is no link between smoking and this disease. But even if there was, then switching to vaping would reduce that risk dramatically. So this is totally made up story with absolutely no, indicates absolutely no risk. And yet it is scaring people away from vaping and keeping them smoking, which is of course much more dangerous. And here's another one which made rounds and which WHO, which by the way is strongly anti-vaping, uses in its materials, that vaping causes myocardial infarction. And this is based on a few papers, and you'll just find that people with history of myocardial infarction are more likely to be vapers. But the thing is that it could be that those who already had myocardial infarction still can't stop smoking are more likely to try things they can try to help them stop smoking, and one of these things would be vaping. And so the link could be purely due to this. And indeed, people looked at this paper and found the original data, and most vapers had myocardial infarction before they started to smoke. So that makes the finding sort of obviously flawed. When they removed the myocardial infarction, which predated e-cigarette use, then the link disappeared. And the paper was eventually retracted. But you can still see this thing about vaping causing myocardial infarction. And this is, to me, the most serious scandal, that the EVALI, the outbreak of lung disease caused by this vitamin E acetate, in addition to illegal cartridges, bootleg cartridges with cannabis oil, has been assigned to nicotine vaping. And I think it was known very early on that this has nothing to do with nicotine and nothing to do with vaping and nothing to do with smokers, that it's just a batch of illegally produced contaminants. And yet it was labeled with this misleading EVALI caused by vaping devices. It wasn't caused by vaping, it was caused by vitamin E acetate. It was never found in any nicotine, e-cigarettes, liquids. Some patients denied using marijuana. They were mostly young people. Marijuana is illegal in some states. They could have been brought to the hospital by their parents. They didn't want to admit vaping marijuana in presence of their parents. But all with confirmed diagnosis had the chemical in their bodies. And of course, when this thing was taken off the market, the whole epidemic disappeared. And there is no question what was causing it. And yet, the labeling of the product and the misinformation, and you still often hear it, that vaping, meaning vaping nicotine, caused this thing, has actually put a lot of people off vaping. In our studies, we see people who successfully quit smoking and switch to vaping, going back to smoking after hearing about this, saying, I don't want to die, I better stop vaping and go back to smoking. So this may have a real life damaging effects, and it's a misinformation which really should have been stopped much earlier. All right, so that's the safety issues. And now the question, does vaping attract young non-smokers to cigarettes? And I think in the United States, there's a strong belief that it does. And in the UK, there's a strong belief that it doesn't. So let's have a look at what evidence we've got. Non-smokers do experiment with e-cigarettes. So that bit of it is true. And in United States, the experimentation is much more widespread than in the UK. And so if you just ask, have you ever tried or did you try this in the past 30 days, you get a relatively high proportion of adolescents saying, yes, they did try it. But non-smoking adolescents who would be vaping on 15 or more days in the past month, which one of the questions is rare, and daily vaping even rarer. So here are some data. In Canada, it's less than 1%. In America, in these two different studies, it's either 1.5 or half a percent. Actually, there's another study suggesting about 2%. But many of these, possibly most, actually use these e-cigarettes to vape marijuana, not nicotine. The question doesn't ask, are you vaping marijuana or are you vaping nicotine? And we have in the UK, the YouGov Youth Survey found among never smokers just 0.1% vaped weekly, and not a single one. They didn't find a single one who would be a daily vapor. And this is the analysis of the US data, which gave rise to this concern that there is a substantial number of young people who are now getting addicted to nicotine through vaping. Martin Jarvis, a very reputable researcher from the University College, and his team analyzed this data, and they're saying a very high proportion, 28% of high school students tried e-cigarette in the past 30 days, but they were mostly people who were also trying tobacco, and frequent use was only in 2% of tobacco naive students. But now comes the important bit. Okay, so they may be vaping, but are they getting addicted? This is about nicotine addiction, not about trying something. 9% of these 2% reported craving, and 3% used the product within 30 minutes of waking up, which are the sort of criteria of tobacco dependence. Among smokers, these figures are huge. Among vapers, they are very rare. And so, it's a tiny fraction of 1%, or small fraction of 1% of tobacco naive youth, which shows any sign of nicotine dependence. I think there is a concern. None of us would want our children to be vaping, but the issue is not by no means as large as it's made up to be. So where does that claim that there is a new smokers are coming lured by smoking, where is it coming from? It's coming from studies which are finding that the same people who try one product try also the other product. And it could be that trying one product makes you to try the other one, that people who drink white wine are somehow induced to also drink red wine. But what seems much more likely is that people who just like wine will try one or the other. Children who are adventurous or rebellious and try stuff, they try other stuff as well. That's called the common liability hypothesis. Which one is true? Well, we actually have a clear answer. And the answer is in epidemiology. Does smoking go up or does smoking go down? As the experimentation with e-cigarettes increase, if you now have more than a quarter of young people trying these products, if it lures them to smoking, you would see an increase in smoking. And if you look, you get something which for us in the UK, we know, and for you in the US may be rather surprising. You see the opposite effect. In America, smoking in young adults have declined dramatically. Over 4 years, it dropped to less than a half. And that's an unprecedented decline. We've never seen anything like that. over the years in which experimentation with e-cigarettes was increasing. Now, you could say this shows that this is a gateway away from smoking and into smoking. I probably wouldn't go as far. There could be other reasons for it, but certainly there is no sign at all of smoking rates going up. And smoking in American youth has been almost eradicated. This is usually hidden by people with agenda who present this data. They will be talking about tobacco use, including e-cigarettes as if it was tobacco. But if you just look at smoking, you can just look at daily smoking, which is this part of the graph. And now and this is girls and boys, and we are talking about single 1 or 2 percentage points. And there are some data from other countries. This is a French study which actually looked at movement from people who first try e-cigarettes and first try cigarettes, what they end up using. And it looks like starting with e-cigarettes reduces risks of smoking rather than increasing it. So I think that that is not really the case, that e-cigarettes are attracting children to smoking. I think what is behind this is a worry that e-cigarettes attracting kids to nicotine use. And that's a very different issue. Smoking is terribly dangerous. It causes lung cancer, heart disease, lung disease, and vaping causes much less of it. It may still, it still poses some health risks, and being dependent on something is not a good thing, but there's a big, big difference between the two. And nicotine use seems to be the main concern behind this sort of moralist issue. And indeed, nicotine use may increase, but here's something reassuring, which you may find interesting. There seems to be only a limited number of people in the population who are attracted to nicotine and who benefit from it. We knew it for a long time. When smoking was very, very popular and there was a social pressure to become a smoker, we still never get 100% smoking prevalence, not even 75%. And when people had a reason to stop smoking, large numbers stopped quickly and were not bothered. And then there's a population who find smoking very attractive, and a subpopulation of these who can't stop and who are truly dependent on it. Now, this is a slide about the Swedish situation. And here you can see smoking going down, being replaced by snus use, snus going up. But if you look at this line, that shows you total nicotine use. So here you're adding snus and cigarettes together, and this is your total nicotine use. And what is rather surprising here is that it stays pretty stable. So, between 40 and 50% of the population are using nicotine. And you may get rid of dangerous cigarettes, and you may allow much less dangerous products, and you very likely end up with the same number of nicotine users. So it's not going to suddenly shoot up to, here it goes just to 65%, but to 100%. It will probably be still many less people than we have who say drink coffee every day, which is another mild stimulant which may actually be more attractive for more people than nicotine. And remember that, talking about coffee, this moralist agenda used to target coffee as well. It was, people were saying that it's harmful to the brain, causes all these diseases. Director of FDA forerunner USBC called for ban on Coca-Cola. And here you have the moralist sound bites coming through. The use of Coca-Cola because of caffeine led to wild parties and sexual indiscretions by co-eds and induced boys to masturbatory wakefulness. And you can sort of feel where that concern is coming from. And this is a a fantastic, ridiculous story, which I may come back to later, but I'm concerned about the amount of time I have. If you want me to come back to it, I can do it later. So we are moving on to the next topic, which is whether e-cigarettes help smokers quit. And I'll go over it quickly. This is a trial we did with some 900 people, and e-cigarettes were more effective than combination nicotine replacement treatment and much, much less expensive. Interestingly, a lot of people who quit with e-cigarettes continue to vape. At 1 year, 56% still vaped nicotine e-cigarettes and another 24% nicotine-free. There was no nicotine in it. They still found it useful to keep away from smoking, that just the flavors and the behavior, they maintain that. Now, it would be bad if there are still some health risks, but if these people, if the other alternatives they were smoking, then it would be a good thing. And of course, it's good if it prevents relapse, it helps with discomfort, helps with weight gain, and enables these people to continue to have enjoyment from what they're doing, some of the smoking rewards. So overall, I don't think it's a cause for concern. There's been where are we? That's an interesting finding, that these people who are using, who switched to vaping for the whole year, they had a reduction in cough and phlegm. And it's known that that some of these humectants in e-cigarettes actually are bactericidal. I'm not saying that this is proven, it's just an interesting hint of a possibility that there may be even some positive issues when you become a vapor. A Cochrane review, it's now a live review, so it's being renewed, I think, every few months. And this is the 2020. There's already 10 randomized comparisons, and they're saying that e-cigarettes with nicotine are more effective than without nicotine. Of course, we know that from over 100 trials of nicotine replacement treatments, e-cigarettes are basically a better version of nicotine replacement treatment. But also they are better than the traditional NRT products, and that there is no evidence of harm from nicotine e-cigarettes used for up to 2 years. This is from the US Stop Smoking Services, a few 100,000 people in there, and you can see that those who were given e-cigarettes with or without the other stop smoking interventions did better than everybody else. Not that different from Champix, that seems to be similar efficacy. Now remember, this is not a randomized comparison, so it needs to be interpreted cautiously. Here are some effects of e-cigarettes on population level in the United States, where it looks like e-cigarette users' quit rates is higher than in non-users, and population quit rate significantly increased. And here is a comparison between Australia, where e-cigarettes are banned, and England and your country, where they are allowed. And you can see that up to about 2013, when e-cigarettes were becoming more popular, Australia were leading the pack in lowest smoking prevalence. And since then, Australia is still going a bit down, but stagnating compared to these more rapid declines in smoking prevalence in countries where e-cigarettes are allowed, which again goes back to the point that if e-cigarettes were luring people to smoking, you would not see this. This whole idea that a competing product will somehow support the incumbent product always was a bit strange to me. When word processors came along, it didn't increase sales of typewriters. And here people seem to be assuming something like that. And this is something which is unfolding currently. IQOS, which is a heat-not-burn product, has become very popular in Japan. By the way, Japan bans e-cigarettes, and so smokers there have only the option of going for heat-not-burn. I think e-cigarettes have better potential to help smokers than heat-not-burn, but they don't have that option. And you can see this is the grand total of all nicotine use, but smoking goes down as the other products go up. And you've got the same picture we've seen with snus, and this is probably also unfolding with e-cigarettes. So on the current balance of evidence, I think I've got about, what, 10 minutes left. E-cigarettes do help smokers quit, and that is supported by population data as well. So the last bit, I'll go over this quickly, about how will the lesser risky nicotine delivery products replace smoking. To make cigarettes obsolete, these alternatives have to do two things. They have to deliver nicotine in the way smokers want, and they also have to provide added value, because otherwise, even if they matched cigarettes, it would still be an effort to switch from something you're used to and you've been doing for many years to something new. Plus, the replacement is not going to be 100%. Those of you who work in this field will know that nicotine on its own has very limited addictive potential. What makes it addictive and attractive is the speed of delivery, but also addition of other chemicals which tobacco provides. And e-cigarettes do not provide it just yet. It may happen in future, but at the moment, the attraction of e-cigarettes will be lower than attraction of smoking, even if nicotine delivery is the same. Which can be compensated by these added value elements. The main of these is actually flavors. So if smokers can derive some enjoyment from fruity or sweet or whatever other flavors, that will compensate for some loss of enjoyment from cigarette smoke, which e-cigarettes can't provide. The other added value elements are lower cost, the acknowledgement of lower risks and reduced stigma, and regulatory advantages over smoking. So the bans on smoking in some places would not apply to vaping and so on. So where are we on these things? The market forces are succeeding in driving some product improvements, and I'll quickly go over some of these. But we have a problem with hostile regulations and bans and misleading publicity, which is slowing down product development and sabotaging this added value elements. I'll skip over these. These are some product developments which are positive. I'll just tell you about our studies, but doesn't mean that we are the only ones doing work on it. There are some excellent groups doing this type of work around the world, particularly in the United States, actually. But we have this paradigm where we have dual users who smoke and vape and who come to our lab after overnight abstinence, and they use the product we want to test, and they have a needle in their arm, and we can see how quickly and to what extent nicotine gets into their system, and we get their ratings, and they also did it for their own cigarettes and their own e-cigarettes, and we can compare these products based on these studies. So here you can see that this is the blue line is a cigarette, and none of these older products could match it. Woos was an e-cigarette with very high nicotine content, 50 milligrams per milliliter, but it still didn't quite match it. But these refillable products did better than the cigalikes, and this is the subjective, it basically tells the same story. Here we have the Juul, the American version, which is very effective. And here you can see this is cigarette, this is Juul, and it just traces the cigarette profile. And that means that this is going to be attractive to smoker and very helpful in helping them quit. This is the UK version of Juul. European tobacco product regulation prohibits e-liquids which has more than 20 milligrams per milliliter. And so the European version of Juul has low nicotine delivery because there's weak battery, just doesn't deliver nicotine at all. This is weaker than a weak nicotine chewing gum, this is not going to help any smokers quit, just to show you the effect of misguided regulation. So are we nearly there yet? The alternatives are getting better, slowed down by hostile regulations. Added value elements suffer. The ban on flavors, which is proposed and implemented in the United States, is really just protecting cigarettes and tobacco industry from this competition. And I think it's bad news for public health. And misleading campaigns such as Evali and so on are putting smokers off the switching. And so it all looks rather negative at the moment. The progress is not as fast as it could be. So let me just finish. I'm just looking at time. Some answers to the questions I posed at the very beginning. How do the risks compare to risk of smoking? A current estimate is that it's not going to be more than 5% of risk of smoking. Do they help smokers quit? Yes, they do. Do they attract children to smoking? No. If anything, they may deflect potential smokers away from cigarettes. However, they may maintain nicotine use in the population, which is the main issue probably for many people in the United States. Will less risky nicotine delivery devices replace smoking? I think definitely they will, but the process is being slowed down unnecessarily by misguided regulations at the moment. So I think I stop that on that somewhat gloomy note, and we can open this to discussion. Nicola, should I close my screen sharing?
You can. Eli, do you want to? There you are.
Hi.
Hop in.
Dr. Hayek, thank you for that fantastic presentation. Struck by the summary of the evidence from epidemiology, clinical, and lab studies. It's nice to see it all brought together there in one presentation. Looks like we have a number of questions. A few were in the chat box and a few were in the Q&A section. So if you put them in the chat box, you can just put them in the Q&A and we'll get to them in the order they're asked. So I'll just read the first question that was posted as you were presenting. We have a question: is there specific empirical evidence showing PG and VG are safe for inhalation? If so, could you please share examples?
So propylene glycol in particular was considered as a potential disinfectant for hospitals. And I think these are studies from 1950s and 60s that there was an interest in fumigate hospital wards to kill bacteria and to check whether it's safe. There were animal experimentation on, I think, dogs, rabbits, and chimpanzees and monkeys. And they were kept in very dense propylene glycol fog for a very long time, I think equivalent to human years. And the conclusion was that there were no adverse health effects. I think there was something about monkeys getting dry faces because it's sort of, it's the humidifier. But it's considered to be safe for inhalation, yes. And for, I think, the same for the vegetable glycerol, there are no concerns that it could be dangerous for inhalation.
Thanks. The next question we have here in the list is we're seeing a commercial about the quote dangers of vaping, which contains metals. So the question is, what truth is there to that?
I would say that it's true that they contain metals. It's not true that it's dangerous. That's the basic principle of toxicology, is the dose makes the poison. The fact that there's cadmium detected there, or you have to compare it with safety norms. Is that on the level which is actually allowed in your workplace when you inhale it 8 hours incessantly? Vapors only take few puffs per hour, and none of these metals, as far as I know, would be anywhere near that level. And all of them would be much, much lower than what you get from cigarette smoke.
Yeah, what you ended on there, comparing to cigarette smoke, I think is the crucial comparison here. The next question is a response to a comment you made. No one would want their children to be vaping. And the question is, why do you think children should not be vaping?
I wouldn't feel terribly strongly, particularly if the choice was between smoking and vaping. I would definitely be happier if my children vaped than if they smoked. The degree of addictiveness, a proportion of users will become regular users and find it difficult to quit. I suppose everything which is pleasant for us would be, for some people, difficult to give up. And a lot of people would watch television 4 or 5 hours a day, every day. And a lot of people, particularly young people, would listen to music several hours every day. And watching television may contribute to obesity and diabetes, and having earphones and listening to music incessantly may damage your hearing. So there may be some health risks to all of this. But we wouldn't be fighting for music-free world or television-free world. Why would we be fighting for nicotine-free world if we can have nicotine delivery, which is actually not any more dangerous than drinking coffee? We don't know yet that 100%, 5% of risk of smoking are still a degree of risk. But in the scheme of things, we're talking about the degree of risk that doesn't really deserve great levels of concern.
Thanks. I will move on to the next question here on the list. Quite often, so I'm reading here from the question, quite often I am asked how much 18 milligram of e-cig pod would contain the amount compared to smoked cigarettes. So I think the question is asking about the level of e-cigarettes, nicotine in e-cigarettes to cigarettes. Would you agree that one pod, for example, Vipe e-cigarette, would be equal to 20 cigarettes?
No, that's a nonsense. Smokers titrate, as I was explaining early on. So a smoker will have a level of nicotine they find pleasant and they want to achieve it. And when they achieve it, they stop getting more. So they would only puff up to the level when they feel they got their fill. And so you don't get smokers overdosing. The smokers get about 1 milligram of nicotine from one cigarette, but they could get 10 or 11 milligrams of nicotine from one cigarette if they really puffed very intensely, but they don't. There is also a built-in safety valve in nicotine products because nicotine makes you nauseous. If you go over a certain level, long before it can damage your health, in theory, nicotine, of course, can kill you. But long before you get anywhere near, you will start to feel nauseous and eventually will vomit, and you just stop doing what you're doing. It's a very powerful signal, and that's a safety valve there. So we never had any nicotine poisonings from nicotine replacement products, unless it's intentional. Of course, there are people who try to commit suicide using nicotine because they read how terribly lethal it is. And mostly they were disappointed. They just vomited profusely, and they didn't manage to achieve their goal in life, to die. But yes, so there's a safety valve and there's a titration. So a person a smoker who would be switching to vaping, and they could get a vaping product with very strong nicotine content, and they are only a light smoker, well, they would just take only a few puffs and it would stop to be pleasant for them taking much more. So they wouldn't be overdosing, they would be titrating.
So to follow up on that, do you think it's worth trying to make a comparison between certain e-cigarette pods and the number of equivalent cigarettes in terms of nicotine? So not even worth making that.
No, I don't think it's productive. But I can understand how people would ask that question. It is sort of a legitimate concern. You have to think about what's at stake, and it's really about how much nicotine that person wants to take in.
This next question is again about nicotine concentration. Do you believe the limit of 20 milligrams per milliliter nicotine concentration in the UK is appropriate? And what do you think, or what do you make of the lack of any nicotine concentration limit in the United States?
I think your regulation is much better than ours in this respect. This is just something which protects cigarettes. It's true that the devices are improving, and what is now possible with strong batteries, and particularly with the you can get most smokers actually get what they need even from those 20 milligrams, but some don't. And there would be a population of smokers who need higher nicotine levels, and they are the ones who suffer the most serious health consequences of their smoking, and they won't be provided with things which could help them because some regulator said so without explaining why. And this limit on nicotine strength has no justification. There is no explanation why is it imposed. It's some vague fear of, sorry, nicotine overdose, which we just discussed, is not a serious concern, or not a concern at all. So I think you're better off than we are in that respect.
Moving on to the next question here. This is a question about secondhand vaping. And this person is just wondering, generally, can you address, talk more about secondhand vaping and specifically exposure of children to adults who vape and vapor from e-cigarettes?
Yes, so there are two concerns. There's a particulate matter and nicotine. And nicotine get deposited on surfaces, but in very, very small levels. And I think somebody calculated, can't remember what it was, that a baby would have to lick, I think, 2 square meters of carpet or window to get 1 milligram of nicotine. So it didn't sound like this is dangerous. I can, if we won't have time for it, but I have a study which was looking at exposure in homes of vapers and non-vapers and smokers, and there doesn't seem to be anything at all. So I think even for babies, certainly for grown-ups, there's absolutely no risk. People sometimes feel, you pass by somebody who vapes and there's this cloud of very strong flavored, for you maybe even smelly stuff. It may be unpleasant and they should be considerate, but it's not dangerous. There is nothing there which, getting a whiff of it could endanger you. That person who's puffing at it massively all day long is probably at very little danger from it, and you're at no danger at all. But for babies and children who touch surface and so on, there could be some, but these studies suggest that there is nothing there either. So I personally think that the risk of passive exposure are virtually none from these products, unlike from cigarettes where there are.
It calls into question categorizing e-cigarettes with smoking bans indoors and restaurants,
Yes.
even in outdoor spaces.
Yes.
So I'll keep moving here. There are a number of questions coming up. I realize we're over 1 o'clock, but if you're okay, I'll keep firing away. Do you think menthol flavors in e-cigarettes offer an increase in value or substitution from menthol smokers, or those races that are more likely to smoke menthol? So let me ask that again. I think the question is getting at, do you think menthol flavors in e-cigarettes offer an increase in value substitution for menthol smokers in particular, as well as those races, people who are more likely to be menthol cigarette smokers?
I would say probably. Rather surprisingly, smokers who switch to vaping actually prefer non-tobacco flavors. Initially, they may like tobacco because it's a familiar flavor, and a year later, we are finding in our studies that by far the most popular are sweet and fruit flavors. And tobacco becomes only a third option after that. So it's not guaranteed that somebody who's used to menthol will still want menthol when they have a choice of strawberry or melon or cake. They may, change their preferences. But certainly initially, we discussed this issue of somebody switching from something familiar to something unfamiliar, and having the same flavor there could facilitate the switch. And certainly, I wouldn't see any reason to ban any of these flavors unless they are shown to be risky. And that, of course, needs to be researched and closely looked at. But up to now, I don't think there is evidence for any of the standard flavors to pose risks.
That's a topic that is hotly debated right now. This next question is specific to the ongoing pandemic, and wondering if you could speak to any evidence about whether vaping increases the risk of infection during COVID-19 pandemic, and whether this could relate to the risk of infection from the flu or pneumonia as well.
I can give you a little talk about it. I actually happen to have 3 or 4 slides here, but do you want me to do that? 5 minutes?
Sure. If you have the time, I see there's a number of participants still on. I know this is
I can show you evidence I was just talking about. I can also talk about it. Let me see. I should be able to find that quickly and then put it on the screen. So now how do I share screen? I share screen here. And there is the slides there. Tell me if you see it. Can you see smoking and COVID-19?
Yes, yeah. I can see that. Yeah.
So there's a living review which you can look at, done by a very competent team from University College London, with no links with any suspect links with tobacco or e-cigarettes or anything else. And they are updating it regularly. And there's now a very large number of studies. So this is your relative risk of getting COVID if you smoke or not. And smokers have significantly, or looks like that. Let me put a big caveat here. This could be confounders. I'm not saying this is proven. There are some confounders which have not been controlled for. But data out there suggests that COVID is less prevalent among smokers than among non-smokers. And rather annoyingly and sort of counterintuitively, ex-smokers are at increased risk. So current smokers, if they seem to be less likely to get COVID, and if they get it, they have the same risk of mortality as non-smokers, but ex-smokers have higher risk of mortality. So that's sort of a strange finding there. There are some hypotheses about how smoking could protect. It could be the nicotine and ACE2 receptors. It could be inhalation of hot smoke. We know that hot air can reduce replication of rhinovirus. By the way, if you get cold, you have to do it very quickly. The moment you feel that you're getting cold, and you put a towel over your head and inhale hot steam, you may stop it. If you do it a day after you got cold, that's too late. Anyway, that was the Common Cold Research Unit, the only result they came to in England. And then there's a tobacco mosaic virus, which colonizes the upper airways of most smokers, and that may also stimulate immunity. But the most important message here would be, first of all, this is not a proven thing. There could be confounders, and there are much stronger reasons to quit. Smokers should be quitting, definitely. The risks of smoking are enormous. But I wouldn't be telling smokers to avoid smoking, to quit smoking, to avoid COVID-19, because the evidence doesn't really justify it, and you run a reputational risk if it's confirmed that there is something about smoking which can be actually then bottled and used for prevention. In non-smoke, of course, you wouldn't ask people to pick up smoking, but if it's mosaic virus or if it's heat, that could lead to some preventative measures. So it's an uncomfortable fact. Smoking is terribly dangerous. You don't really want to publicize a potential benefit of smoking. That would be ridiculous. It's not about smoking. It would be very important to know if this effect exists, what's causing it. But it's sort of just a counterintuitive finding. But it's according to this living review, as you can see here. Your question was whether smokers are more likely to be more severely affected, and neither hospitalization, I only have mortality slightly, but hospitalization, same thing. It doesn't seem to be significantly different from non-smokers.
Yeah, really, really fascinating findings here. I think the question was initially asking about e-cigarettes and vaping rather than smoking, but I think.
Sorry, I misunderstood.
But very relevant and could be related.
Yes, for vaping, I'm not aware of any good data. I'm aware of some poor data, but not good data. I don't know.
So I see we're 10 minutes over here, and I'll just ask one final question. This is a follow-up on the earlier question on nicotine concentration. So how do we explain that reductions in smoking in the UK, or how do we explain the reductions in smoking in the UK if the lower nicotine levels aren't effective? So earlier we were talking about the restrictions on nicotine levels.
They are effective, but they would be more effective. Juul, I would expect Juul to be more effective. In our trial, it wasn't Juul, it was e-cigarettes. People were given a starter pack. We gave them a refillable e-cigarette and a couple of bottles of e-liquid tobacco flavored, and they were told, this is just to, we explained to them how to use it. And they were told, go out and buy your own supplies, find flavors and strengths which fits you. And then we gave them, I think, 18 milligrams. And some people ended up with 12, some went to 20, and all sorts of flavors. And that's where we know that they went from tobacco flavors to the other flavors. So that's one advantage we have, that there is this great market out there with various products, and that smokers are more likely to find something which is tailored to their need. They can find stuff which they like. Some of them bought, although we gave them this initial product free, some of them then bought something else. And I think we could make good use of that. So if you're advising smokers who find quitting difficult and maybe tried medications that will help them, and ask about vaping, I would say yes, that's another approach you can take. And you need to go out and try a few of these products, see if you find one which fits with your needs, and use that variety which is there.
The idea being having a wider range and choices of nicotine concentration could serve those who require higher nicotine content.
And flavorings as well, yes. And yes, and I run away from the actual question a bit. Yes.
Well, I think, it definitely relates though. So anyway, I appreciate you staying on over time here and answering these questions. And thanks to all the participants who logged in today to hear the talk. And yeah, thank you again, Dr. Hayek. That was a fantastic talk.
Eli, can I, before you close it, will I be able to read the questions people put in there? I'm interested in that.
Nicole, do you know how we can get Peter access?
Or let people log off and I'll read it and tell you when I'm done.
Let me see. I
see we have a chat going and Q&A. I was only reading from the Q&A.
The Q&A I think is mostly where they all are. Peter, if you can see that. There should be a Q where it says Q&A towards the, I don't know if it's on the top or the bottom for you.
Oh, adolescent brain development. That's a shame I didn't speak on Okay, and yeah. Oh yes.
Well, Peter, if you would like to keep talking on some of these questions, feel free by all means.
How many people do you still have on? Can you see it?
There's 29 of us, 30, well, 29 attendees, and then with a couple of us, there's.
Okay. So in US, teens trying vaping are a higher socioeconomic group than those who were trying cigarettes. One concern we hear from middle-class moms whose kids would not have been experimenting with cigarettes but vape and may become nicotine addicted now. Yes. Yes. And it's driving the panic. Yeah, I guess so. I think middle-class parents have much stronger voice than working class parents. Yes.
Could you read that out loud? I'm not seeing that question.
Oh, it's in the chat, Eli. It came through. It says in US, teens trying vaping are higher socioeconomic status than those who were trying cigarettes. So one concern we hear from middle-class moms whose kids would not have been experimenting with cigarettes but vaped and may become nicotine addicted now from their vaping when they would not have because they would not have smoked. I think that this socioeconomic difference is driving a lot of the panic in the US, which, I mean, I think that's what it's probably a valid point. Those higher class parents have a louder voice. And that's what I think what Peter, maybe you were agreeing with that statement.
Yes. Yes.
Which is, I think, typically what most people experience across a broad spectrum of issues.
Yes, I think Carl Hart is making that point about marijuana.
Right.
All right, guys. Well, thank you very much for bearing up with me. And I think we've got this meeting with your team, Eli, don't we?
Another 15 minutes. Yes, thank you so much, Peter. We really appreciate you being with us.
So I log in at past on the other one.
Yes. Yes. Great.
Is that right?
Yes.
Yes.